We hope to provide you some information today and engage you as an audience. This is going to be, as you've heard throughout the whole presentations in the different parts of the meetings here so far, is that this is going to be a very interactive presentation. We want to engage you as the audience in a conversation. So I am going to encourage you to ask questions. We will have a roving mic. I have one. There'll also be another one on the floor. We want to use those to hopefully so that everybody can hear the questions effectively. But this is something that we want to encourage you to engage in and talk about this discussion about mobile healthcare and ubiquitous healthcare and where we really are going in this particular market space. So I do want to introduce our panelists. First off, I'm Chuck Parker. I'm the Executive Director of the Continua Health Alliance. It's a not-for-profit alliance of about 245 member organizations that's truly focused on setting and engaging the standards for personal health care, or personalized connected health in this case. So we are working with many different standardization bodies to incorporate and build out a complete end-to-end chain in a way to make these devices truly interoperable and plug and play. So first off, I do want to introduce our panelists. We have Damien Balsan, who's the Director of NFC from Business Development, Joe Carangelo from GreatCall, Mary Cronin from Boston College, and Matthew Davis and Matt from Gartner. Damien is going to step up first. He's got a little bit of a presentation to kind of outline some of the things, some of the new tools that are coming out as well. So he sort of has a dual role. He works with NFC as well as with Nokia. So first off, Damien. Just want to step up there.
Works. Yes. Okay. Hi. Yes. So I'm Damien Balsan. As you can hear from my accent, I'm French. Nobody's perfect. I work for a company called Nokia. Nokia is still, maybe not for long, but still the leader in mobile phone. It pretty much makes 400 million phones every year. Has an install base of 1.8 billion people with phones, and as you know, reaching a population in the world of nearly 5.5 billion people having mobile phone. I'm in charge of the near-field communication activity. Near-field communication, I'm going to explain you what it is. It's a very simple connectivity from the phone to sensors. And I'm also based in Boston, and beyond my activities at Nokia, I have created with the MIT Enterprise Forum something we call the NFC Cluster Boston for encouraging innovators and developers to create applications based on this new technology, NFC. So I guess a lot of you know what is NFC. It's a pretty much wireless connectivity technology that enables very simple connectivity to a RFID sensor. It's pretty important because until now you had Bluetooth, you had all kind of other technologies, but when you start talking ease of use, I don't know when is the last time you have tried to connect something Bluetooth, but usually beyond the geeks and the people that are really used to it, it's tough. We have seen a lot of development in the healthcare with Bluetooth. We think that the inclusion of NFC on the phones is going to really revolutionize at least the health, the home health sector. Yeah. Wellness, we're going to talk the difference between health and wellness and what's the limit. But we think it has tremendous possibility, and it has tremendous possibility for the innovators and the developers. That's kind of the work I'm doing, spending my time with the innovators on that technology. So the kind of things you can do with this technology is, I'm going to go fairly fast, but the most important thing is touch a sensor and get information from it. In that particular case, I have a phone with an application. This is a sleep application. I have touched my sensor before going to sleep. I wear it with me during the night. And when I wake up, I just collect the information and send it to a server. Because it's easy, because it's simple, we see lots of use cases. This is one. There are 50 other use cases that applies. There are other reasons why NFC is developing, and you have probably heard more about it. It's when we talk about the security and the fact that you can have your credit card on the phone. This is not the subject today, but that is why every smartphone is getting the technology starting this year in the US. So just to give you figures, every smartphone is coming next year with this technology. We're getting to more than 150 million phones next year, included in Samsung, RIM, with every OS, Windows, Google, RIM. It's pretty much everywhere. We're going to have a critical mass of phones by 2013, and by 2015, about 600 million phones have this technology. So remember Bluetooth 10 years ago? It was starting, it was getting to 10%, 20% of the smartphone. Now there's no phone that doesn't have Bluetooth. NFC is going to be far, far quicker. What is very interesting also, and that's pretty much my last slide, is that sensors can get integrated with this NFC technology. And we're getting to very, very low cost of sensors. The market we see for sensors that can be integrated with NFC is more than 1 trillion. And I'll be happy to kind of send you these slides. So you can use humidity sensors, temperature sensors, weight, what have you. And this applied to the market of home telehealth can really be revolutionary. So these are just examples. I've shown you this an application done by Impact Health, in fact Meridian Health, which is a very a known company in the US. They've developed that with T-Mobile on different operating systems. You have the medication control. You have the smart patches. It's your imagination. You are the people that are making this market. And my message to you is, if you are in Boston, even if you're not in Boston, join the MIT Enterprise Forum NFC Hub, and you will be in contact with other innovators and be able to launch your ideas. That's the mission of that hub, is just to make this happen. Thank you.
All right, thanks. Next up, we'll have Joe Carangelo.
Thank you, Jeff. I just want to thank everyone to allow me to participate in this forum. I do not have any slides. I'm being part of the panel. I'm from GreatCall. You'll know us better. We are the creator of the Jitterbug cell phone. We're changing our business model significantly from selling phones and rate plans to selling value-added mobile health services. We were very progressive in the short term of doing that, and I look forward to participating in the panel.
Sure, thanks. Next, we're going to introduce up here is Mary Cronin. She's a professor at Boston College.
Thanks. I'm in the IS department. I like to tell my students at BC I didn't grow up using the internet and mobile, but I started as fast as I could. And for me, that was literally 20 years ago. I wrote a book called Doing Business on the Internet in the early 90s. And in the late 90s and the past decade, I started tracking wireless and mobile. And in particular, recently, last year, I had a book on smart products, that is embedded wireless in consumer products. I looked at the impact in different industries, and a big light bulb came on in my head that more than automotive, more than energy, more than a lot of other industry sectors where embedded wireless was very important, healthcare was where there was really the most potential for transformation and revolution. And that was 2010 when that book came out. And I'm here today because I still believe that. We're not ubiquitous mobile healthcare yet, but in this panel we're going to debate why. And I think there's reasons why it's starting to happen, and we will see it in this decade. Thanks.
All right, thanks. And last up is Matt Davis from Gartner.
Good afternoon, everybody. So I work with Gartner in IT research. So about a year and a half ago, Gartner acquired a company called AMR, which is a supply chain research firm, and that's actually where I work. My research coverage area extends into embedded software, connected products, M2M communications, and I cover the high-tech market. But because I'm in the supply chain research side, I'm looking at what corporate strategy says is what is the future, and supply chain responds with, okay, how are we going to go do that? So I've been looking a lot at how technology is starting to converge across industries, the impact of high tech into healthcare. And there is a big push now, we've probably heard this all over the last 2 days, around services and solutions. And a lot of the manufacturers in this space who are positioning themselves as solutions providers, still trying to figure out what that means, and looking at a lot of integration of hardware, software, and services. And so that's a primary area of research for me.
All right, thanks. So once again, I want to remind you that feel free to ask questions. What I want you to do is if you do have a question, raise your hand. We'll make sure to get you a microphone. And certainly feel free to ask questions at any time at this point. So, and if you start to or want to engage in the conversation here, we certainly can do that relatively quickly. So there's a couple of mics. I'll hand one out as well, and we have another one here as well. So feel free to raise your hand, and we'll certainly get you engaged here. But I think a first question I want to start off here with, and this sort of leads to the title of the presentation, that's around consumer health. We've heard a lot about consumer health, and there's a difference potentially developing between consumer health versus the healthcare environment itself, which is plugging into the provider organizations. I just want to see what your comments are on. Do you see this market as two separate markets, or is it something that's distinctly that are going to head into a clash together?
I see it as definitely two markets right now. I think of it as a real mobile health divide, in that there is a huge opportunity for the healthcare industry, the healthcare provider, the payer, to take strategic advantage of healthcare monitoring in the home, amazing devices for chronic disease management. And we've heard a lot of it this event, and every event, there's a raging debate about payer responsibility, reimbursement. How is that going to figure into accountable care organizations? So that's the one side of the divide. I see actually three parts to it. The second is, and I'm looking at this for a new book project, how doctors are actually adopting smartphones and iPad tablets in particular, and that's changing their care delivery and changing their ability to have mobile resources for diagnostic and formulary for prescribing and e-prescribing. And the third is, of course, the consumer side. And so one of the reasons I think we're not seeing ubiquitous mobile health adoption is those three parts haven't come together yet. And in fact, although the consumer side is huge, there's 9,000 apps and so on, there's great products for consumers that are self-pay. In my opinion, until the three parts of the puzzle come together, we're still going to have a barrier to adoption.
Mary, I would concur. We see it as a market segmentation issue. The two penetrated segments that you see on one end of the spectrum, is the motivated healthy, and they're the ones who are the main early adopters of health and wellness. At the other end of the spectrum, on the institutional health side, is the chronically ill. Those that have comorbid conditions, CHF, that it's an economic benefit to put a remote patient monitoring technology into their home. But in the vast middle is a number of market development niche opportunities that are specific to a disease state that, in a perfect world, you would penetrate from both sides. You would learn from the consumer-facing side and apply that knowledge to the institutional health side. That being said, I think the mobile health service applications from both sides profile very, very differently. We can get into that a little bit later.
I was just going to say, I think when you look at what's happening right now, the biggest issue is with data and data interconnectivity between the two different markets. And so we've sort of reached the peak of inflated expectations right now. Mobile health is really hot. And so we're seeing proliferation not just of hardware, but of software as well. And so what that's resulting in is that consumers are sort of moving more toward the self-help on their phone, trying to download applications, and taking that on as a sole experience, but there's no way to connect that data back in with the hospital system. And so until the integration issue can be resolved and we can start to see PHR start to get integrated in on more real-time basis, I think you'll continue to see the markets kind of heading in different directions, because truly they're solving two different problems.
Okay. We have our first question over here.
So I have a question.
Okay.
I have a question for Joe.
Hi.
You talked about GreatCall moving from being a product, a mobile phone-oriented company, to a services-oriented. What do you hear from consumers about the value of the services you can bring to them for seniors versus boomers? Is there a difference of what you're hearing?
Well, our working hypothesis is, well, GreatCall is a smartphone. The Jitterbug is a smartphone that was specifically designed for those wanting a simplified cell phone experience. Now, through some of our distributors, the first initial target segment was certainly the senior mature market. And everyone attributes Jitterbug, and therefore GreatCall, as we've rebranded the company, with that market. We recently launched another device. It was in the Wall Street Journal on Wednesday, a responder device consistent with our 5-star urgent response system, in which it was recognized that, and it was designed for the simplified mindset, still applicable for the seniors and the mature market, but also for other market segments. Our working hypothesis is this, that the senior set profiles differently today than it did 5 years ago, and it will profile differently 5 years from now. So we're instilling some strategies to take advantage of that. All of our mobile health services, and I won't go into them because I don't want to turn this into an advertisement. I want to make sure that this is simply a case study. All of our mobile health services will go on other mobile platforms. We launched our medication reminder, a refined, bolstered medication reminder on iPhone. Our 5-star service was just launched on iPhone. So we think, again, what you learn from a simplified mobile health experience can be applicable to the consumer health side, and vice versa as we continue to develop the institutional health franchises. Does that answer your question? Okay.
All right. Matt, you mentioned something a little bit earlier in your conversation there, and talking about the hype cycle. And it's sort of, are we at that inflated expectations level of the hype cycle, and are we facing the valley of despair?
Yeah, so if those of you who might not be familiar with the hype cycle, several years ago, Gartner started to look at how technology gets released into the market, and essentially identified this very steep bell curve that kind of travels up and then peaks down and then ultimately comes back. And there's a technology trigger, which is the introduction of something new to a market, and then we all, as early adopters, sort of follow this peak until we reach the peak of inflated expectations, which is where everyone tells you there's the panacea tomorrow, but no one's doing it quite today. And when we hit that peak, we tend to fall down the slope of disillusionment. And then ultimately, when we hit that bottom is when people really start to enable the technology. And so what we know about the peak of this technology trigger is that's when the market is completely flooded with new ideas. Everything seems like it's going to be a great option. But there needs to be time so that the market can kind of sanitize itself, and we see how mHealth really adopts. And so when we released our hype cycle for 2011, mHealth is directly on the peak of that curve, meaning as you have these discussions, there's going to be a lot of options that seem like they could be great solutions for you, and 3 to 5 years from now, a lot of those things are going to be gone. And so the key is to identify what we really think is going to catch on. Some of those things, I think, when I think about it with mobile health is, what do you get out of a mobile phone that you can't get out of your computer? What is it about having that in your hand as opposed to just logging into a system that's better? Or what are some new things that patients really care about? So it's the ability to do monitoring of yourself, medication adherence. These things seem like they're here to stay, but I think the key message when you look at a curve like that is to be thinking really, really critically right now around what investments you make and make sure they're going to be long-lasting.
Sure. So, Damien, you represent some of the old line organizations that have been looking at this, so you kind of have a different viewpoint. You're introducing a new technology with NFC, but you're also representing an old line.
Yeah, absolutely. Yes. So, I think what we see again is see the massive number of smartphones in the hand of people. This means the massive number of apps downloaded. You're getting to 50 billion downloaded apps. So, and then see the ease of use that is introduced by the improvement of the experience on the mobile phone. So when we look at these kind of three factors, and we start looking at what are people downloading as apps. So Yes, the number of health apps is not kind of huge. Well, it's still in the tens of thousands of apps, but it is definitely growing. And we see people starting to use them. They don't need forcibly to send the data back to a PHP provider or whatever. They're just using them because they feel good without it. And we think this is kind of the first phase. I'm getting data. I'm happy. I see a graph with a very simple thing, taking my weight. Okay, if it's very simple, and you see companies like Withings, you have this on iPhone, you have this on pretty much every operating system. People buy a mobile scale just to get the data. It's very simple. It connects Wi-Fi or it connects directly to your phone, and you've got the graph. There's going to be more and more and more of that. And yes, there's going to be a second phase when there's more and more of these apps with all kind of the applications we've seen where it's going to be fairly obvious, like, okay, how do we move that up? And what is the regulation? How is it going to happen? But initially, for me, there's like 3 years where you're going to see a growth, of these apps for very basic data capture, and this is going to converge to something very, very integrated.
So Mary, you had a response as well.
Yeah, I'd just like to comment on further Matt's point, because actually, I don't think, Matt, that the capabilities are going to go away that are at their peak of the hype cycle right now. A lot of companies are going to go away, and a lot of individual app makers are going to go away. So I think what we need to be aware of and look for right now and over the next 3 years is who's capturing the platforms and who's capturing the data. Because I completely agree that that integration of the data and the platform that can allow you to track your sleep or your weight or your aging mother in Toledo is going to be a very powerful solution that is going to prevail. And that may be just a handful of companies compared to dozens that are offering some of those capabilities right now.
All right. We have another question here in the front.
Yeah, sure. Speaking of platforms, I'd like the panel to comment on this sort of expansion that's taking place on the continuum of devices to smartwatches. I think actually because of the proximity and the relationship to my watch, which I use more than my smartphone, this is a really interesting device, and particularly as it becomes wireless and connected to my smartphone, which becomes the link up there. So how do you guys see this new generation of watch technologies coming in, which might have sensors and other things built in? I can think of a case study with diabetics where it reminds me to do my glucometer and everything much better than my smartphone, which I have a different relationship with than my watch. Any comments, please?
There's already, for seniors, a lot of watch-based technologies that are managing balance, alerting to falls, providing medical reminders. And just what Joe said, as the next generation of seniors, and that will someday be all of us, they don't want to wear something kludgy that says I'm, ailing. So embedding that in a watch or something that is attractive and normal to wear is a very, I think, smart thing that is definitely going to happen.
Yeah, and I think what this all comes back to is for me, it's going to be the software and the applications that really provides the value, and hardware in many ways is just a vehicle to do that. I'm just looking down, and I have 2 mobile phones and an iPad, and it's because each one kind of lets me do something different. So I think the solution going forward in this space is going to be to identify what people are comfortable with, and this is where supply chain comes into play, is that we know demand is not one size fits all. And so when you're delivering upon demand to these multiple markets, we're talking about global markets, you have to consider all of the different ways that people want to access the software. And so what we should see is some proliferation in the ways that people access the data and consistency around what that data is and how it's managed. And if a watch has big enough demand, then the supply chain is going to figure out how to bring that in at the right price point.
All right. And I would go a little bit further and say I don't think it's only going to be watches. I think there's other technologies that we're going to see beyond that. You're going to see devices that are even Band-Aids that you just basically apply to yourself that you wear for 7 days that are disposable. And I think that the technology is going to get to that point where it's A, disposable, and B, potentially even implantable at a surface level. So we've already seen this with the continuous glucose monitoring, with the ability to put a chip under the skin so that you now have the ability to start doing some very complex things in the future. So I think that's going to lead to a whole plethora of new devices. It's not, I think watches are an interesting platform. Yes, I do believe that. But like Matt says, I think, you're going to have different devices that are going to serve different needs. And I think GreatCall, you've got one with your little monitors that you actually wear as well.
Exactly. I think you're going to see it. There's two dimensions you can go. The actual body medium with the chip is embedded, and it directly goes in the cloud, or you're going to use the watch as the gateway. So with low energy transmission. I can see it go in a number of different ways.
Yeah, I think that's going to bring up some interesting challenges as well, obviously with security. So I think that's one of the other things that we need to address is, what do we see here with the level of security in this particular aspect? Is this going to be an area where consumers need to be worried, or is it something where we think that we have the technology today to handle that?
Both.
You want to take that?
I just said both because we should be worried about our email lack of security. We should be worried about the apps we download onto our smartphones. They all have security problems. So this is going to have probably some major security issues, and it's, again, along the hype cycle, a predictable phenomenon that as it becomes more ubiquitous, that our data about our vital signs and our health and fitness is kind of just being transmitted out into the cloud. It's going to be intercepted. It's going to be compromised. There's going to be some incidents that vendors will start to address. I don't think security has ever been a major barrier for consumer adoption in the digital age. There's been regulatory barriers created because of security concerns, and to me, that's more of something that I hope we'll get to debate is, what is the impact of the regulatory environment right now for mobile health adoption. But yeah, I think security is a problem, and I really do think that we need to, as experts in the field, as analysts and as vendors, have credible answers and coordinated answers when those questions are asked about how are you encrypting and how are you protecting the data.
I think another dimension is, I think there's enough security out there, and there's always security breaches, but once that data is, wherever it is, warehoused, how will that data be used? What is going to be acceptable uses of that data? I can foresee a clever marketing person taking a look at the data that might be and saying, hey, I can use that data to cross-sell somewhere. And there's going to be, I think, some interesting regulations going forward on the use of that data, what is appropriate and what is inappropriate. We've already begun to see that with some of the high-tech provisions.
All right, we have another question over here.
Yeah, I have a question because there are things that concerns me with all the things that we are measuring now. I don't know if we are measuring too much, and what will happen to the false positives if you, in terms of costs of the healthcare. If we have doctors reacting to every small signal of a problem of thousands of patients at the same time, what can happen? And the other question that I have is, what do you think about the platforms that exist to provide, in fact, information, not data, to the doctors, so they can manage instead of having, let's say, 10, 20 patients a week, and then they must deal now of 200 or 2,000 patients. I think all these things are very centered in patients and less in doctors. I'm not a doctor, so I can say it.
I think from the data perspective, you bring up a great point. There's been talk of, The Economist talked about the data deluge. Some people talk about big data. There's more data today than we have nearly enough bandwidth to deal with. So I think in the short term, what you'll see is the focus on data will be more about creating efficiency in the process and not necessarily about getting better at, say, predictive diagnosis. And I think data on the consumer side is going to be used more to know kind of historical things about your body and how your body works so that you're more informed when you go into the care delivery process, as opposed to seeing massive changes in the care delivery process itself. Now, there is huge opportunities. Someone yesterday was talking about unstructured data, and if you can take advantage of unstructured data, you can start to find relationship attributes and predict outcomes and things like that. We're many years away from that, and I think the key focus, at least from what I'm seeing on the electronic side of deployment into healthcare, is how do I help make the process more efficient and drive cost out, as opposed to really influencing the care delivery that occurs.
Yeah, so I think just to follow up on that on the big data side, I think that's something that, one of the things, and to your point, your second part of your question, and I'd like to respond to that myself, is that I think that what we're going to see is this need, not necessarily about every data point. It's, every data point may actually be irrelevant in the future. What we're really interested in are trends. Is this person going up or down? Are they trending inbounds or out of bounds? And what you're also going to see is this level of healthcare that's going to diversify. It's not all going to be centered around the physician. So, it doesn't take a physician to be able to see a trend line going out of bounds and being able to pick up the phone and call the individual and say, Mrs. Jones, are you okay today? Is something happened? So there's a first line of response to that, management of those disease states. So I think that there's a possibility there in those cases that you're going to see a diversification within our healthcare system of job duties. So the workflow is going to change, if you will. And that what you do get, though, is a potential reaction to the data that is appropriate to the physician, which means that this is truly not a false positive. So in essence, you've had that screening, Mrs. Jones, are you okay? Yes, I'm okay. I just happened to, maybe the blood pressure cuff didn't work right, or the weight scale, I stepped on it at the wrong time, or something happened along the lines. So you can eliminate some of these false positives from a consumer-based activity like that from a simple level of screening that doesn't involve the physician in that case. But you truly are escalating the problems that truly do exist and need to go to the physician in those cases. So I think that you'll see that, automation has that capability. Not only that, decision support systems that are already available today in existing electronic medical records in physician offices already have this capability as well. So we have that inherent capability. Things will get smarter, processes will get smarter. As we have this new data stream, I'm certain that individuals are going to find new ways to use that data in different ways too.
And while it's not occurring at the patient basis, we are seeing embedded software and connected products actually managing the electronics themselves using that same statistical process control. And so the healthcare device manufacturers who have this embedded capability can monitor the individual components of the devices themselves and kind of predictively know if something's going to fail. So they're developing software that says, red flag, how do I know how to manage this? And while we're not machines, they're at least learning how that software works and the right ways to handle escalations and things like that. So,
and in the preventive realm, and to Chuck's point about everything doesn't have to go to the doctor, if you think about devices like the gait monitors, whether they be the slippers or sensors in the carpet of a senior citizen, it's become very possible to see from patterns of gait when someone is really losing their balance, when they are less well balanced on their feet for a couple of weeks, the likelihood that they are going to have a fall and that fall will result in a fracture, depending on their age, is significant. So, does the doctor need to be told that this person is starting to get a little unbalanced? Maybe not every time, but the insurance company probably would really like to know, and the family would certainly like to know that this could be a time when an intervention could prevent a really serious and potentially debilitating and life-ending injury. So we are technically at that point right now. We can do those things. And so that is why this adoption question that we're looking at today is so critical. What is preventing that adoption of those technologies? What will allow the data that is now very unstructured and very overwhelming to be used in a way that can really change the health and wellness profile of consumers.
Damien, do you have a response as well?
Yeah, I just invite you to have a look at the research of Sandy Pentland at the Media Lab. He has launched a couple of startups that are leveraging the information from the mobile phone very simple things. How many times you call, when you call, where you are, and apply that to the health sector to send information to insurance for people that are opting in, to say, well, when is this, predicting the science of predictability. When is this person going to turn ill? Is this person going to go back to the hospital? I mean, things that are very, very specific, important data for the different providers that can change totally the economics for all of these actors. So it's kind of really interesting, just with the deluge of data that you can get from the mobile phone, not even entering anything, what you can see today with terabytes of data computed and algorithm. I'm not going to go to the details, but just go to Sandy Pentland's research or check his book that is on sale. We're seeing it now, and I'm seeing it more and more structured.
Okay. We have another question in the back.
Yep. All right. So thank you. So I'm interested in, you talk about there being the motivated healthy and the chronically ill, and that there's a really big gap in the middle between them. And you can see that those two segments, the finances are aligned, right? So the motivated healthy, they're willing to pay. They enjoy that status. The chronically ill, there's insurers willing to pay. There's people who want to keep them well, and hopefully they've been sort of galvanized out of fear to at least put an initial shot of energy in. But in terms of that big, large swath in the middle, it looks like there's a couple barriers. One for ubiquitous monitoring is battery life, and hopefully things like the NFC is going to help that. And then the second seems to be cost. So what are the sort of triggers that you see before the living well really jump into this, with both feet? That seems to have the best opportunity to do long-term, to fix our long-term care. And yet that's the group that doesn't seem to be as excited, at least now.
That's a great question. Again, we see it as market segmentation, and we see it as developing market development strategies. One of the things that I've only recently heard today at this conference is this sense of urgency. Do we have a sense of urgency of bringing telehealth and remote patient monitoring technologies to either end, the motivated health end or the chronically ill end? We heard a speaker eloquently say we have 10 years to fix our healthcare system. I heard someone at West Wireless in DC in the spring say we have 5 years. Whether it's 5 or 10 years, we have to get started. I'm not hearing a lot of sense of urgency. One of the questions I had is it really a question of technology development or market development? I feel very strongly it's market development. If you go to the ATA, next year is in San Jose. Last year it was in Tampa. There's plenty of mobile health technologies. There's plenty of first generation, even second generation remote patient monitoring technologies. There's plenty of technologies out there if we want to get started, if we want to move from the early adopter stage. So I think some of the barriers are certainly cost. And you're going to see the cost of some of these gateways go really down. You look at the first generation remote patient monitoring technologies. I'm an engineer, I'm a former engineer, I can say this. They were designed by engineers. Way too much technology put into that gateway. So as a result, capital cost of $2,000. If you want to amortize that over a PMPM per member per month, you couldn't place that instrument for less than $200 to $250 per member per month. And we're surprised that the only disease state that the first or second generation remote patient monitoring technologies ever proved a financial return were in the area of CHF, or acute cardiac monitoring. The only disease state. So I think you're seeing, even those, and we applaud those efforts of those first generation developers, they're here in the exhibit halls. We wouldn't be talking about RPM without them. But even they will admit that they have to look for lower cost gateways. And our position, again, simply as a case study, is that the cellular phone can be a low cost, low risk to implement gateway for remote patient monitoring. We have a number of times in this conference I heard perfect cannot be the enemy of good enough. I think we have good enough. There's plenty. The most difficult thing is to get that key clinical metric, whatever it is, depending on the disease state, into the cloud. Once it's in the cloud, it's only data. Do whatever you want to it. Compare it to a threshold, provide any algorithm you want. communicated out through any type of mobile technologies. But the most difficult thing is getting that key clinical metric into the cloud in a cost-effective way. That's a major barrier. And I think if we come to a realization that time is of the essence, we do have a sense of urgency. There are a number of wonderful technologies already out there. We can get started and begin to attack some of the market segment conditions like sleep and diabetes and such that populate that unpenetrated, as of yet, middle of that bell curve. I'm sorry, did that answer your question? Okay, great. Thank you.
And I want to bring it from that question. I want to bring this back full circle to where we started from, and that is it's actually addressing the two market segments that we talked about. One is on the consumer side, and one is on the chronic disease state side, which is actually in the clinical environment side itself. So I think that what you're taking a look at here in this market space is that you now have what we would consider to be at least two starting locations within those two respective segments that we identified at the very beginning there. And I think that what you end up with is sort of a cascading effect. So these are the markets for which we know that we have a requirement and are either A, actively engaged from the healthy well, or B, are costing us a significant amount of money for which we know that there's cost recovery in the system itself. So I think that from there we can actually build it on what we've heard is some of the models, some of the data analytics that go into this, the big data that we can now acquire from those, and begin then to trickle down to the next level of the market space itself, and you eventually get to that middle, and at some point these markets do merge, and I think that's what we've talked a little bit about, that there is a merger here, and I think that we've talked sort of in between here and not necessarily identifying a consumer market versus a health and a direct healthcare environment, but we've talked about them sort of in a combined manner, and I think that's what you eventually will see. Today we distinctly have two markets. In the future we'll have two separate ones. So I just want to let everybody have an opportunity to say the last few statements here. We're at the end of the time here, but anything else from the panelists? I just want to see if you have another statement.
Yeah, I mean, just very simple things, but I think the ease of use that is getting introduced by technology like NFC, and the dramatic shift in costs of sensors is really going to produce an explosion. 10 years ago, we had Bluetooth started. Now it's starting to be on medical devices, thanks to the incredible work of Continua. It's very powerful. The next generation, with the improvement that NFC provides, leveraging Bluetooth, by the way, but in a smarter way, just in a one-touch connection, the incredible decrease in the cost of sensors with things like printed electronics is really going to get hundreds of millions of people. And we're really doing studies for that, starting to test for things very simple like blood pressure, things more complicated like glucose monitoring, weight management, the basic signals. And again, once this is adopted, you need like 3-4 years, people kind of really getting used of the simplicity. You're going to get the next generation, which is now the integration of the data.
I think I'll go back to the question that gentleman just asked. I'm also doing some research on sustainability, and there's some very interesting parallels if you look at what's happening in the sustainability research as what's happening in this space, is that 10 years ago there was a lot of talk around green supply chain and really becoming sustainable and getting to a lower carbon footprint. And there was a huge proliferation of ways to try to measure that, of ways to try to optimize your supply chain, and none of them really caught on. And what happened was legislation started to get proposed and passed, and that happened a lot in other markets, and we saw where manufacturers had to prove out that they could do these sustainable offerings. And then legislation started to get discussed here in the US, and it started to put pressure around manufacturers to figure out how to solve that. At the same time, consumers started to change the demand, and companies recognized that they could actually make a profit off green products if they could prove that they were sustainable. And so what you saw was consumer pressure started to come on and say, hey, I want a green product, and I need you to prove to me that it's green. So I think what we're seeing right now is a big proliferation of hardware, software, services, and what I would be looking to is what's being proposed in legislation, how likely is it to be passed, and when will it come through, and then look at the providers in the space and say who's making money. Who's been able to identify that there's value in something and then deliver that value to the consumer? Because what they're doing is, we said there might be this consolidation of some of the companies down the road, the capabilities stay there. The people who figure out how to manage the data are the ones who are going to have successful products today. And I think they are going to lead the charge into the future of what we'll see in this whole space. So those are the two places I would be following to try to figure out what's going to happen next.
And I would just agree with that and add, if you think about the power and the inexorable trajectory of improvement in capability of that device that you have in your pocket, and that 4 billion people around the world have that more or less equivalent power in the fully connected device that they are carrying around, most of us on for a good part of the day, and how suitable that device is and how much more suitable it's becoming for mobile health applications, whether they be embedded and automatic and reporting into a platform where our data is going to be tracked and trended, or whether they be used to really motivate us or our loved ones to change their behavior in some positive way. I think it's really just when. The question is, when is the majority adoption going to happen? It probably won't be next year, but it will be sometime in this decade, and the companies that get that when right and that help to accelerate that, I think, will be the big winners in the marketplace.
Just a couple thoughts. What an exciting time to be in this space, because it's formulating in so many different dimensions. And second, you'll see a lot of companies detailing devices. And I'll leave you with this thought. It's not the devices are the enablers. It's not the device. It's the service. The service in a couple of dimensions. Design the correct service. You now then position yourself for premium pricing opportunities and premium penetration opportunities. Thank you so much.
Yeah, thank you very much for attending, and I say thank you again for the panelists.